Artificial Intelligence Doctor. www.abcpharma.net. User question. Aveir VR LP versus traditional pacemakers. Phrenic nerve stimulation analysis clinical question. What is the incidence of phrenic nerve stimulation with the Aveir VR LP compared to traditional transvenous pacemakers, and which anatomical positioning factors within the right ventricle correlate most strongly with phrenic nerve capture? Comprehensive answer. 1. Incidence comparison key finding. Leadless pacemakers demonstrate significantly lower rates of phrenic nerve stimulation compared to traditional pacemakers with left ventricular leads, though comparable to right ventricular traditional pacemakers. Aveir VR LP and leadless pacemakers. Aveir DR system. Dual-chamber recent clinical data shows an extremely low incidence of phrenic nerve stimulation at only 0.5%, 2 of 381 patients, at 6-month follow-up. All instances were atrial leadless pacemaker-induced and successfully resolved through reprogramming. Aveir VR, single-chamber, while specific PNS rates for Aveir VR alone are not separately reported in current literature, it shares the same potential complications as traditional single-chamber pacemakers with active fixation leads, including phrenic nerve stimulation as a recognized but uncommon complication. Traditional transvenous pacemakers. Cardiac resynchronization therapy, CRT, with LV leads. Overall incidence. 15 to 37% of patients experience PNS, clinically significant PNS. 3 to 26% of patients requiring invasive intervention. 1.6% of cases leading to CRT termination. 0.3% of patients right ventricular traditional pacing. Temporary RV pacing. 6% incidence permanent RV pacing. 45% incidence in high-output testing scenarios clinical significance, typically lower than LV pacing 2. Anatomical positioning factors highest risk locations. Apical positions. 6.1-fold higher risk of PNS compared to anterior positions. P equals 0.001. Lateral wall positions. For 0.1-fold higher risk of PNS compared to anterior positions. P equals 0.005. Midlateral and mid-posterior sites. Significantly elevated PNS incidence lowest risk locations. Basal positions. Minimal PNS risk anterior LV sites. Lowest incidence among all positions septal positions. Generally favorable for avoiding PNS anatomical explanations. The left phrenic nerve passes along the obtuse margin of the left ventricle in 79% of cases and frequently overlaps with left marginal veins. This anatomical relationship explains why posterolateral vein placements have higher PNS rates than anterior or septal positions. 3. Clinical implications and management advantages of leadless technology. Elimination of lead-related complications, no pocket-related issues, lower overall major complication rates. Risk ratio 0.33, 95% CI 0.25 to 0.44. Simplified implant procedure for RV pacing management strategies for PNS. Non-invasive approaches. Successful in greater than 95% of cases, reducing pacing output to 1.5 times capture threshold electronic repositioning with multipolar leads pulse with adjustment, up to 1.5 milliseconds. Programming different. Pacing vectors invasive options. Rarely needed lead repositioning pericardial patch isolation for. Conclusion. Summary. The Aveir VR LP leadless pacemaker demonstrates a favorable profile regarding phrenic nerve stimulation, particularly when compared to traditional CRT devices with left ventricular leads. The incidence of PNS with leadless technology appears to be substantially lower, 0.5% for Aveir DR system, than traditional LV pacing, 15 to 37%. When PNS does occur with leadless devices, it is typically manageable through non-invasive reprogramming. Key anatomical consideration: avoiding lateral and apical positions in favor of anterior, basal, or septal placements significantly reduces PNS risk. The leadless design allows for precise positioning within the right ventricle, potentially avoiding high-risk anatomical zones that are problematic with traditional lead placement. 5. Clinical pearls PNS is position-dependent and often more pronounced when patients are in left lateral positions. Pre-implant mapping capabilities of Aveir VR-LP allow for electrical signal assessment before final fixation. The retrievability feature of Aveir VR-LP, 92.5% success rate for implants greater than or equal to 5 years, provides an additional safety margin if repositioning becomes necessary. Patient body mass index does not significantly influence PNS or pacing thresholds. ABC Pharma, Artificial Intelligence Dr.